today's episode, we will be looking at sickle cell. It's still Sickle Cell Awareness Month, and it is only right we keep raising awareness and to educate and inform people that there's help out there. And myself, I didn't know much about it, but I had to read about it, and also through Jennifer, I learned quite a few about sickle cell, and also what can be done to eliminate stigma associated with sickle cell disease. So I'm joined by Jennifer Anafi Acquah, who is a sickle cell patient, and also Adwoa Danso. Thanks again for joining me on the Health Dialogue.
Thanks for having us.
Thank you for having us.
So I'm going to go straight into it. I'll come to you first, Adwoa. Sickle cell is common in people with African background and Caribbean background, and it's also estimated that there are 150,000 people with sickle cell in the UK, and that's because of increase in immigration into the country and new births.
Yeah.
So, and I'm guessing that is mainly Black people. So can you expand on what sickle cell actually is?
Yeah, so I mean,
it affects mainly Black people.
Yeah, I think it's mainly African, and we also see people of Asian backgrounds as well, and a very small number of some sort of Mediterranean people with sickle cell. But yes, it's more common in Black people. In terms of sickle cell and you know what it is, I think as we have evolved, you know, particularly with the areas around Africa, we have malaria, and we think that in order to protect ourselves against malaria, we kind of our genes changed, and we know that people who are carriers of sickle cell, so not actually affected by the disease, are actually protected to an extent from malaria. So we think that that's how it's genetically evolved over time. So it's a protective factor against malaria. In terms of what it actually is, we know that sickle cell is basically a blood disorder. It's a disorder that's inherited, so it's passed on from your parents, and it's a disruption of the red blood cells. So in your blood you have red cells, which are kind of almost like disc shaped things that float around in your blood, and that's how they should be, almost like a donut but filled in the middle. But with sickle cell you have more of a crescent shape, so kind of a, you know, if you take a bite into a Jaffa cake, I always say, and what's left of it, so like a moon shape, that's what happens with their blood. So the majority of their blood is sort of a crescent shape. So if you imagine the sides of that, so the corners are really sharp, and they can stick together and stick into small blood vessels, and that's what we know is sort of crises, and they can cause other types of problems associated with the shape of the blood.
So Jennifer, when were you diagnosed? When was it detected?
So I was born here, but then I grew up and spent most of my childhood for about 6 months in Ghana, and I wasn't diagnosed until I was, I think, nearly a year old in Ghana. I think at the time, I mean, 29 years ago, gosh, I'm showing my age, 29 years ago when I was diagnosed here, so when I was born here, I wasn't diagnosed. It wasn't sort of, I think now it's part of a roster of tests that they do for newborns. Dr. Danson will be able to confirm that, yeah. But it wasn't done when I was born. So when I went to Ghana and lived with my grandma, I think I started getting crises, and I was crying a lot, you know, a lot more than I suppose a normal baby would cry. And from what my grandma had told me, that there wasn't any obvious signs of, I wasn't hurt in any way. I would, you know, they were feeding me, changed that, would do all the normal things you do for a normal baby, but I just wouldn't stop crying because, you know, I was having a crisis. So they took me to the clinic, and obviously being Ghana and like how prevalent sickle cell is in West Africa, that was one of the first things that the doctors over there thought might be wrong. So they tested me, and then I was diagnosed in Ghana about just before I was 1.
And it's so funny how they were not able to detect it here, but now it's different from back then, isn't it?
Yeah, it's completely different. And interestingly, or maybe not interestingly, I sort of a personal note, I grew up my whole life not thinking anything about sickle cell. And it wasn't until I had to have a pre-op for surgery, and I was a doctor at this point, they asked me, do you have sickle cell? I said, no. Do you have carrier? No. They did a test and they discovered that I actually have the trait, and I had no idea at all. So in terms of and I was born in Israel, so that's probably why I never knew. So, but here in this country, all babies are tested for a range of inherited diseases as well as some other diseases, including sickle cell. So you have what we call a newborn blood spot, where you check for common inherited diseases, and sickle cell is one of those as well. But also, when a woman is pregnant or even trying to conceive, we really try and encourage women, particularly Black women, to be aware of their status, of knowing whether or not they are a carrier or even have the disease, and if their partner has being a carrier or not. But I guess we'll probably talk about that a little bit later. But yeah, things have changed, and I think it's because, again, Jennifer, you might have more to say about it, but it's people are more aware and people are more able to manage some of the aspects of sickle cell disease, although it is a very difficult condition from what I understand to have and to live with. People are more aware and more knowledgeable about how to deal with it.
Yeah. So, with Jennifer, with your parents, were they aware that they either had it or they were carriers?
No, neither of my, so for them, and obviously Adwoa said, back then when they were thinking of having children, it was something, obviously, I guess back in Ghana they knew that some people had, but we didn't really have any immediate family that had it, so they, I guess, had no reason to suspect that it would be something that was even in their family. So neither of my parents knew that they were carriers until they had me, and then I was diagnosed in Ghana, and then it was explained to them, obviously, how the sort of how I got it and the genetics of it, and it was because they were both carriers. So neither of them knew at the time that they got married, decided to have children, that they were carriers, and this is something that they would need to consider when having children. And
do you have other siblings?
Yeah, so I have a sister who, as luck would have it, she has both of their non-sickle genes, so she's not even a carrier.
Wow.
And yeah, so we were both the 25% on either end. That sort of, I got both their sickle genes, and then my sister got both their non-sickle genes. So she doesn't have anything, but she was. My parents obviously insisted on her being tested as a result of me having sickle cell as soon as she was born. So we kind of found that out pretty early on.
Yeah. So I'll come to you, Adwoa. You did mention traits. I just want to get a full understanding of the trait and the carrier. Is it the same thing, carrier or trait?
Yeah, they are the same thing. So to be affected with sickle cell disease, you would need to have both of the sickle cell genes. So, for example, Jennifer, your mum we assume that she's a carrier and your dad's a carrier, right? Because they don't have the disease. So they'll have one normal gene and one sickle cell gene, your mum, and then your dad will have one normal gene and one sickle cell gene. And you inherit half of your mum and half of your dad. So as luck or would have it, you would either be not affected. You could be 50% chance that you have trait or have carrier because you have half of the gene, or a 25% chance that you're affected by the condition. So trait, carrier are both the same. So you're not affected by the disease, but you only have one of those genes that you may have inherited.
So with Jennifer, would you mind talking us through your symptoms? What are some of the symptoms that you have?
Yeah, so with sickle cell, some of my symptoms that I have it varies because they can be quite mild, and then obviously you go all the way up to the big sickle cell crisis. So for sort of mild things, I'll get sort of mild aches and pains in my joints, sort of smaller joints sometimes. I can get quite tired because with my sickle cell comes anemia as well. So I can get quite tired a lot of the times. So those are kind of, I guess, I would describe those as the milder end of the spectrum. Then when I have a crisis, so that's when I have a sort of a full-blown attack, I get really severe, really intense pain that can be anywhere from, you know, joints like my wrist, my arms, my legs. Really bad, severe ones would be sort of my chest, around my rib cage. So those are quite bad because obviously as you breathe and your rib cage moves in and out, that increases the pain. I've had some that's been in my jaw, so my face has had a crisis. So those ones for me are like one of the worst ones, because obviously, you know, your face, you move your face a lot, whether or not you want to or not. So sometimes that increases the pain. But as well as the sickle cell crises or the attacks of pain that kind of comes, it lasts, I suppose, they call it short term, but it can last anywhere from a few days to sometimes weeks. But then as a complication of the sickle cell, you also get associated sort of diseases or associated conditions. So as well as the sickle cell, I have something called avascular necrosis, which is more of a chronic pain. So that's sort of like a kind of a pain that I have all the time in my hip joint. So that's, I'm sure, you know, Dr. Danso will hopefully be able to explain in the more technical terms, but essentially as I was growing up, I had quite a lot of sickling in my hip, in my legs, and as a result of that over the years, it sort of left my joints quite weak. So avascular necrosis is something that sickle cell patients tend to get as they get older. Some patients get it, you know, in their teen years or early 20s. Others get it a little bit earlier on. I think I got mine when I was 19 was when I was first diagnosed with that. But that's a sort of a long-term chronic pain. So those are kind of like some of the symptoms and some of the sort of associated conditions that comes with it.
So do you take like medication every day? Is there a specific treatment that you're on?
Yes. So I take, another, I guess, side effect, I guess, probably not the best word, but another part of having sickle cells, I have quite a bad immune system. I tend to get a lot of sort of colds and coughs and sort of like, you know, bacterial infections. So I'm on penicillin, so I'm on an antibiotics every day. I'm also on folic acid, which is sort of supplemental iron, again, I think to help with the anemia. So that's sort of like the basic level of medication. And then on top of that, I take I take a variety of pain medication throughout the day, depending on how bad my hip is. And then that medication, I normally take codeine or dihydrocodeine. I also take a long-term pain management, which is something called nortriptyline. So that's something that I take for kind of, again, to help with the avascular necrosis, my hip pain. And then when I have a full-on crisis, so something that's my pain level spikes above the normal, I can either up my dosage of dihydrocodeine. There's sort of like kind of steps that I take. So I'll sort of up my dose of dihydrocodeine. If that doesn't help, I've got oral morphine. If that doesn't help, then it's sort of hospital admission. And then that's sort of, I get intravenous morphine and other, like, I suppose, more intense pain management. So yeah, so in terms of medication, I also take vitamin D, which I think all Black people should take anyway, but yeah, so just again to kind of the other supplements that can help and vitamins that can help. But yeah, so those are kind of, I guess, the variety of medications. I'm also on something called hydroxycarbamide, which is from how it's been described to me, or sort of when I sort of went on it, it's a sort of a very mild chemotherapy sort of drug, but there's been benefits found with sickle cell patients in regenerate fetal hemoglobin, so regenerate a type of hemoglobin that absorbs oxygen more, which is helpful for sickle cell patients. So that's a drug that I've been on and I take every day. I think I've now been on it for 4 years. So that's really helped in terms of decreasing the amount of crises that I have. So yeah, so that's all cocktail of drugs.
You've been admitted to the hospital quite a few times, isn't it?
Yes. Yes. Unfortunately, even with all of those medications and management, there's still those times that, you know, sort of triggers stress, whether sort of if I get an infection or something else, I still get a crisis, and then I get admitted into hospital. Yes.
So I'm coming back to you, Adwoa. Jennifer did mention triggers. That's a term that they normally use for the sickle cell disease. So what are those things that trigger it? I know she said,
I think triggers are a really important thing to talk about, really, because it does vary from person to person, and as we said, we've discussed that, you know, it's to do with the shape of the blood cells. So we know that anything that makes your blood thinner or thicker will mean that they're more likely to stick together. So being dehydrated, for example, it would mean that there's less blood volume going around the body. So again, you're more likely to have crises. So important that we all drink a lot of water, but particularly people with sickle cell disease. So making sure that, you know, if it's nice weather like we have this week, you drink extra water, you take lots of precautions as well. Stress, another big one. Stress, sometimes even things like the cold. So I remember speaking to one of my patients, and she was at uni, and she wanted to go out with all her friends and didn't want to pay for the cloakroom, and she had a crisis because she was cold. So, you know, and she laughs about it now, and you know, she was just telling me about that. But it's one of those triggers that people have to remember. Even in warmer weather, you've got to try and make sure that you don't get too cool, pretty much, and drinking plenty of water, and stress, and alcohol as well. So again, I'm not sure if she combined both, but alcohol is also triggered because, you know, alcohol can dehydrate you. You don't have as much water as well, and that can trigger crisis, and as well as infection. So when you are run down, feeling more tired as well.
And that's a lot to take on. Back at you, to you, Jennifer. Living and working with sickle cell disease, I know your job entails a lot of traveling. So how do you juggle both? How?
Yeah, it is quite intense. It's one of those things where you just constantly have to think about it. And, you know, sort of, I was sort of like smiling at when Adwoa was talking about her patient, because I remember being at uni, and you want to do all the normal things that all your friends do, and you want to go out in December and, you know, not pay for a coat room, but it's the consequences of you doing that with sickle cell is so much more than any other normal person that doesn't have it. So it's, in terms of living with it, it's one of those things where you really, for me anyway, it's constantly on my mind, and it shapes everything that I do, and the way that I think about everything, and the way that, you know, I do everything. So like with my job, it does, involves a lot of travel. And recently I had a work trip to Australia, which was, you know, the longest flight that I've ever been on, the longest sort of continuous flight that I've ever been on. And for the rest of my colleagues, it was just a matter of like, oh, what book am I going to bring? What films am I going to watch? And whereas for me, it entailed about a month before, 6 weeks before leaving, me consulting my doctors. I needed to get a blood exchange transfusion. I needed to make sure that I had enough medication for the trip, as well as extra in case anything happened. So it's sort of, your life kind of becomes a lot about preparing and sort of planning for the inevitable, planning for, you know, just if you have a crisis, what are you going to do? So there's kind of, sometimes it means that you can't do things. I mean, that's definitely happened quite a lot in my life, but other times it just means finding the ways of how you can manage, and how you can still do those normal things, but taking the precautions to make sure that you're safe. So for something like my work trips, I always, whenever I have a flight, as long as it's, you know, Europe flights are usually fine because they're only a few hours and I can usually cope, but even then I'll let my doctors know. I usually, if it's anything longer than say a 4-hour flight, I would usually have a letter that I would bring ahead on the airline, just to let them know in case I might need additional oxygen if I were to have crises. Sort of like making sure that I've got sort of socks to help in terms of circulation. I always sit on the outside edge of the seat and along the aisle so that I can walk up and down sort of every, you know, half an hour, 45 minutes to make sure that circulation's going. So like I'm never in a situation where I might get a clot or I might get sort of like I might increase the chances of getting a crisis. So especially something like flights, where I know when I go on holiday, a lot of people are like, oh great, I can get some free drinks, you know, some free alcohol. But for me, it's like what Dr. Danso said, like I sort of try to avoid alcohol on flights, especially with the altitude, making sure I'm drinking a lot more fluids. It's just that thing of always having to think and always having to prepare for the thing that you want to do, which can be quite exhausting, and sometimes it's quite mentally draining to always just need, you know, if your friends invite you somewhere, you're like, oh gosh, I've got to make sure I've got an appointment with the doctors, I've got to make sure I've got enough time to get a blood transfusion, I've got to, it's just your mind is constantly on the go all the time.
Wow. And Adwoa, you know, Jennifer did mention it can affect you mentally.
I think absolutely. You know, unfortunately, I hear some really terrible stories of, you know, people being in situations where they're in crisis, and, you know, unfortunately, people with sickle cell do actually have to attend hospital frequently, and, you know, at times their pain isn't taken seriously, I think. And that has a lot of connotations and difficulties, and that's because, you know, they may unfortunately are seen as seeking, they need those higher drugs that often other people abuse, so the morphines, the tramadol, you know, strong painkillers. So unless you really understand how severe these pains are, even as a healthcare professional, you really have to be mindful to how nobody wants to be in hospital. That's the first thing. So if somebody is there in pain, you really need to take them seriously, and that can be a mental challenge. And you know, sometimes people with sickle cell lack that they lose a lot of trust with some of these healthcare professionals, because they're not taken seriously, and then they kind of try and do things by themselves, which can land them in more difficulties. So yeah, there is a lot of help, and there is help and support out there for people with sickle cell, and I think it's great that Jennifer's come on here to share her story, because I mean, I've met you and I didn't even know, you know. So I think it's important to know that, you know, people with sickle cell can actually lead very normal lives. That's the first thing, and you know, it just takes preparation, like you said. I mean, I didn't even think about that, about, you know, the airline and the planes and the oxygen and the altitude. I hadn't thought about that. I think about what am I going to pack, and, you know, what hotel am I staying in. So, you know, these conversations are really, really important. And I think for people who have friends as well, or children, I think it's really trying to think about their needs a bit more rather than your own. Too, but as to answer your question, there's lots of services out there. The other thing I think we should mention whilst I'm here at this point is about blood donation, which I'm not sure if you're probably going to get to, but you even mentioned, Jennifer, about having your exchange transfusions before travelling. People with sickle cell rely on blood donations, and there is such a low uptake of blood donations within the Afro-Caribbean communities, and we have a specific type of blood that matches with other people of our community. So we are the ones that need to be donating blood to help and improve the lives of people like Jennifer. So I have to really stress that.
I was going to say, I mean, a huge emphasis, and I don't think it can ever be overstated, about the blood donations, because I mean, for me, it's for me and for patients like me, it's literally a lifeline. It's the difference of being in constant pain and being, you know, and sometimes it is the difference of, you know, of life and death. And I've had crises so bad that I've needed emergency blood, and it was it's the difference between life and death. So I can never overstay and never kind of tell anybody how much appreciated it is, or how appreciated it is for patients like myself to have people within our community donate blood, because, you know, like Adwoa said, it's the best match for us, and it goes such a long way, and to making just somebody's quality of life, it's just such a huge difference. And yeah, I can never applaud people that give blood enough, because it really does make such a huge difference to people like me.
So Adwoa, for those who are not aware of where to go to donate blood, where do we have to go?
I'm going to look up the website for you in a second, but the NHS Blood and Organ Donation Centre, they have lots of centres up and down the country. I'm going to Google the website for you. But you go on the website, you type in your postcode, and it brings up your nearest blood donation centre. And it also gives you an idea as to whether you are suitable to give blood. A lot of people think, oh, no, I'm not suitable because of X, Y, Z. But they actually are so in need of blood that they do specific individual, assessments to see whether you are eligible. So don't put it off, just get it done, and I will try and find that for you now.
Sickle cell disease in itself comes with a lot of stigma. Jennifer shares her experiences and the impact it's had on her relationship.
The overarching, I guess, problem that I've experienced or I've seen is that people within our community, there isn't as much understanding about sickle cell, and I think a lot of the stigma comes from not really understanding or knowing what sickle cell is or how it affects. So yes, you do get, I've experienced aunties and uncles and sort of other people's parents, like not necessarily knowing that they were talking about me, but have just openly said, oh, I would never want my child to marry a sickler, which is, it's just the kind of the generic term that people would say, just be like, oh, no, oh, no, I wouldn't want my son to marry a sickler, because it's seen as this taboo, oh my goodness, you're going to bring this diseased blood into my family. And it's just that lack of understanding, which, it's hurtful, firstly, because it just kind of puts you on this sort of island by yourself, like you're not accepted even within your own community. But then when it actually comes to getting in relationships and having conversations, I must admit, when I was younger, I definitely saw my condition as just my condition, that, I could deal with it, I was best equipped to deal with it, and I didn't even need to really involve anybody else, like the people that I was dating. So I would only ever tell people like a need to know basis. So if I happened to have a crisis and you were there, then I'd be like, oh yeah, by the way, I've got sickle cell, just follow these instructions. I already have a bag packed. I've got my medication here. So I already I sort of planned my life around me being in control of it, or me trying to be in control of it, and just having that information. But then as I sort of was growing up, I then told a partner that I was dating that I had sickle cell, and initially, this is an ex-partner, initially they said it was fine, don't worry about it, it's fine. And then sort of as we carried on dating, I guess it must have weighed on them, actually, the idea of dating somebody with sickle cell, is something they just didn't want to deal with. And it, that relationship ended as a result of not wanting to deal with my sickle cell sort of in future. And obviously, I was heartbroken, I was upset. It's one of those things where I had no control over having sickle cell, and but then as time went on, it became something like, actually, it is something that will affect the future partner as well. Affect possibly any children that I might want to have. It'll affect our relationship. So I then made the decision in my next relationship, which is my current one, at the very beginning, just state it out there. Put it out there, just say, I have sickle cell, this is what it entails. It may or may not affect you, depending obviously how well this relationship goes. But if it's something that you feel like it's too much for you, exit here. So I was kind of very, as I've grown up, I think I've become a lot more vocal about it. But it's definitely really tough. And I've spoken to other sickle cell patients who find it a really tough conversation to have, because, as I've grown up, I have realised it is something that absolutely takes a big feature in your relationship. I recently had a really big crisis, and so very thankful for my partner and how he dealt with it. But it is something that it makes you understand that actually the person that I'm going to be with does need to understand this, should be open to wanting to learn more, and will affect any future family that we want to have. So it's a really difficult and sensitive conversation. I think different patients and different patients deal with it differently. I've obviously had to learn sort of along the way and kind of had some bumps with it, but for now, I definitely absolutely believe in, saying it from the beginning. But I know that I wasn't like that, 5-6 years ago. So it's quite a sensitive topic to bring up.
I think Jennifer touched on such important things there, and I am seeing, patients coming more and more. so I've had patients that have just got engaged and they've decided that this is the time to, check their status. People are other partners or the other family have asked the girl or the man to come in and check their status. I mean, I think it's different for different people, and the timing is also crucial. But if you do, it's a personal decision, but in terms of treatments and trying to diagnose potential children with sickle cell, there are things in place. So if for example you have somebody who's a carrier and somebody else who is also a carrier, and then the woman falls pregnant, and you would like to know whether your child is going to be affected or not, yes, there are tests that can be done to see whether your child is affected. Those would involve sampling some of the blood whilst the woman is pregnant from the baby. Does carry a risk, to check the genetics. It does carry a risk, about 1% risk of miscarriage. But those tests are available for people who are at risk. Just to give you the website before I forget, it is very easy to remember, actually. It's my.blood.co.uk. So so you just have a look on there and you go to where to donate, type in your postcode, and then you can find everything there in terms of nearest blood donation centres. But yeah, there are lots of treatments available as well, and there are great specialist centres specifically for sickle cell up and down the country. So we are more aware and we are more able to deal with it as well.
There's a negative connotation when it comes to life expectancy of somebody with a sickle cell condition. However, here in the UK, new treatments have shown that many people with the condition can live a healthy life and live longer.
What I am seeing more of is that people don't die from sickle cell disease. They die of something else, as they get older. And that's probably one of the reasons why I'm not really familiar. It's not we do see people who are quite young, unfortunately, passing away from sickle cell, but it's also a disease that has very varied severities, and also people manage it very differently too. So what I will say is that people do very well. The majority of people manage their symptoms well. People are very, people with sickle cell disease are very, 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 very clued up about what their disease is. And I think people are taking them more seriously when they do present to A&E, to the GP surgery with their conditions. So, as I said, people are doing well. The life expectancy is much, much higher than, several decades ago. And that's a testament really to people with the disease and being able to speak out about it. I've learned from this, and it's such an important topic, and I just don't think we can stop talking about it. So thank you for sharing your story.
Thank you, and that's what we have here on Dialogue. So much, ladies. I really appreciate it. Yeah. So thank you so much, Jennifer, and thank you, Adwoa. And I hope to see you soon. Thank you.